So week 10, exams done, going into HESI. Saturday at 2 p.m., I'm going to be doing a HESI Q&A review. I will be sending you a PowerPoint that matches along with it. You also all know I do have that YouTube channel. You can start looking at last quarter's HESI Q&A review and then see if there's any different on the one that you're going to see this Saturday, right? Just little minor changes it. What I do the HESI Q&A, I'm trying to make you think, not just memorize answers, but also to try to, how did I get there? What was that thing? What does it mean? How does it relate? How do I treat it? How do I know it's working? What's my outcomes? These are things I'm trying to make you think when I do that HESI Q&A. There are recordings there. You can go back and look at them. You can come to the new one on Saturday, or you can listen to the recording because, again, I will post it for you. I'm also going to be posting the PowerPoint. I'm going to be posting all of your Kahoots and the 200 question Kahoots, and then all the weeks. If you want to go back and look at maybe cardiac, maybe look at, one of those areas that you felt weaker at. Okay. So we do have this week due another discussion question. I think I just got done with other discussion question, trying to catch up on all of them. So that I did at least get those done. You do have a CJ Sims, and you have your practice exam that's also due in your RN, that the Saunders area, the Evolve, to get that done. Those grades automatically go into your grade book, if you were wondering. Okay. And again, it's always first attempts. Be careful. So you've all agreed you want to do a 50 question. All right. I pulled it up. Where is it? Here we are. And as soon as we're done, class will be over. And again, I'm going to get that HESI stuff up for you as soon as I can. How do you study for the HESI? Do the HESI Q&A. Look at your Kahoots. Other last place to look at is your NCLEX book under pediatrics. Your HESI NCLEX book. Some are red, some are green, whatever the color is, but this is the book, pediatrics. This has a lot of HESI hints in it. And those HESI hints are important. So you've got everything you need. Okay, let's get going. So just to be aware, next week is your HESI. There is no class. We will meet briefly on week 12 just for attendance. And I'll be sending this out in an announcement for you, okay? You must get your week 12 attendance in. What if you missed week 1? That's 2 weeks in a row. That could be a problem for you. I don't want it for anybody. Here we go. A toddler swallows grandma's digoxin. What should you anticipate? What's the doctor going to order? And probably of grandma's pills, digoxin is probably the one that children do swallow. So when you're worried about digoxin, what does digoxin do? It slows and strengthens the force of contraction. So if a toddler swallows it, they're swallowing an adult dose. We're worried about that heart rate and being toxic that quick. And we want to get it out of the system so it doesn't affect that heart and slow it down. So we're going to think, what is the antidote? And it's digibine or digoxin immunofab, a multi. Signs of respiratory distress in infants. Infants are pretty unique and they don't breathe well. And a lot has to do with you're going to see the little nose go in and out. And if beyond that nasal flaring, you're seeing that little grunt, that eh, eh, at the end, and they tend to bob with it. That child's about to completely stop breathing on you. That is an emergency. And then, of course, the restlessness is showing you hypoxic. When a pediatric patient has an amputation, what priority teaching is very important? It doesn't matter adult, child. You get an amputation, a finger, a leg, an arm, whatever it is. These are things that should be done. And it's all about, the stump, especially if it's a leg. We want to protect it from getting skin breakdown because we want to put on a prosthesis, especially with children. We want to keep them mobile, right? So you always inspect the area. A multi-select. What is acute myeloid leukemia in children and what are the symptoms? There's ALL, there's AML, they're both a type of leukemia. What are you going to see? Remember, AML is more difficult to cure than ALL. And the classic signs are, remember, the cancer does go and deform the white blood cells. It also attacks red blood cells. That's why you're anemic. You don't have white blood cells, you're going to be up for getting frequent infections. You're immunosuppressed. And part of it is bone and joint pain. And of course, it's eating your platelets. So we're bruising. So these are classic signs that bring children in and then find out they have leukemia. A multi. What may be a problem seen after surgery for a child with tetralogy of Fallot? Remember, tetralogy is the pulmonary valve closes up suddenly and doesn't let blood go to the lungs. So it's a tet spell and you go hypoxic. Now, after surgery, they're already exhausted from, these tet spells preoperatively. After surgery, we need to watch out for that going into congestive heart failure. Remember, the heart is weak and the lungs can fill up with fluid. With that, they're going to be tired, they're going to be fatigued, they're not going to be able to eat because they don't have the energy. And then, of course, that respiratory distress because their lungs are filled up with fluid. A multi are defects associated with tetralogy of Fallot. Remember, tetralogy is right-sided. So the only thing that you all didn't really do was VSD. There is a hole between the ventricles, okay? And that actually lets some of the blood flow around, alleviate some pressure on that right ventricle. It's actually a protective device because when that pulmonary artery gets obstructed, blood can't go up, that right ventricle stretches. And with a hole between the two ventricles, it's not going to let that right ventricle stretch. And the aortic valve is on the left side, so it is not an aortic stenosis. An 18-year-old parent wants this kid's lab results. Can you do that? It's an 18-year-old. Well, my first question would be is, are they cognitively aware and alert? And if they are, that child is in charge of himself, which means they sign for their own consents for the ER or any lab or any procedures. And one of the things you have to be careful with is when parents want results from a child who's 18 because of HIPAA, you've got to ask that child, that 18-year-old child, can I give this information to your parent? Your NCLEX loves questions like this one, so that's why I throw it in here. What is synergist and why is it given? I think a couple of the things you need to re-up yourself on is indomethacin, prostaglandins, synergist. What are they? And what are they used for? And that just shows you right there. The RSV vaccine given monthly for those children premature or immunosuppressed will be getting that RSV. First year of life, usually from winter to early spring, to try to prevent that virus because to suck, swallow, and breathe is enough effort. You don't want to put mucus in the nose and then they can't breathe. Okay? Closes the PDA into methicillin. It is not an antibiotic. Very good. And growth hormone, that is not synergist. The growth hormone could be from the anterior pituitary, right? What is the highest priority with a pre-op infant with bladder exstrophy? Hmm, that's one of those bladders born on the outside of the body. Omphalocele, gastroschisis, bladder exstrophy, born on the outside of the body, even myelomeningocele. Your insides are on the out. Our biggest priority is infection, keeping the integrity of that skin and also preventing infections. Having normal saline sterile at the bedside, sterile dressings. That is what we would do for that child. A 10-year-old wants an insulin pump for type 1 diabetes. Can a 10-year-old get an insulin pump? Insulin pumps, you put one needle in the body. And I actually had a type 1 diabetic student who told me she'd leave that one needle in for a week. And that's what her doctor had done. That means one stick, every week instead of multiple sticks every day. It is a great option for a cognitively aware, alert child who can learn how to problem solve, bolus, and take their own blood sugars. It's a great option. Multi. When and why would a Lyme test be done on a child? So a Lyme test is from ticks. We would say that ticks are in grassy, wet, swampy areas, and we would take it after the exposure. Now, first, the thing that we would do if we had a child who was out in the grass, found out one of their friends got, a tick, would be to inspect the whole body. That's number one that you would do. And then you pull out the ticks. And then, of course, we're going to see, the little wheels come up. So we will do a testing about 1 to 2 weeks later. And it's a blood test, and we're looking for the Borrelia burgdorferi, which is a tick. Okay, and we'll be looking for it. Ticks can create a lot of havoc in the body. I've actually seen, Lyme tests done because they've gotten this from the tick that's caused even cardiac problems, and it's taken multiple doctors to figure out what has gone on. Sometimes it's very hard to figure out. What might you see after administering a bolus of albumin to a child? Remember, albumin is concentrated protein. We use this a lot for things where this child is swollen and we want to suck fluid back into the intravascular space so that we can get rid of it, right? So we give albumin, it sucks fluid out of interstitial back into intravascular, and it goes through the kidneys and urinated out. Many times they follow that with a diuretic like furosemide. So albumin, putting the protein back, getting the fluid where it needs to go, will increase urinary output and decrease edema. A multi. What's another term for erythema infectiosum? There are some common childhood diseases. There's a chapter on them that we don't get to, but this is one of those things that I've seen on HESI. One of the concepts. So I put it in here to let you know about it. An erythema infectiosum looks like a slap face, and the reason is these cheeks are all pink. Okay, it's also called fifth disease. It is a virus. I've seen big rashes all over, like big demarcation rashes, itchy, 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 um, fevers, and then, of course, those big red faces. And again, it is infectious. You can bring it from child to child. It is a virus, so it's just symptomatic treatment.
I had fifth disease as an adult while I was pregnant, and I lost a
Oh,
baby
it's
because
horrible. Oh my
yeah, I lost
goodness,
a
I'm
baby.
sorry.
Yeah, 20
Oh, I'm
weeks.
so sorry. What's the treatment for pertussis? It is a very strong virus. You're very right. I've never heard of it with adults with pregnancy. Oh, I'm sorry about that.
Yeah, I guess it got like in the first 20 weeks, it's like a 70%. It's real high rate of miscarriage in the first 20 weeks.
Wow.
I didn't know
Wow.
I had it. So I was working in childcare and I didn't know I had it.
Wow. Wow. That's interesting. Something that I learned today. So pertussis, there is an immunization for it. Remember, it's respiratory, extremely contagious, and the treatment is Zithromax, and it would be airborne isolation for that child. How do you get rid of cradle cap on an infant? That white crust. I think that question comes a lot when you have a little girl and you want to put cute little bows in her hair. They've got all this white flakes going on. Oh, you want it to get all nice and clean so that you put a bow on your little girl and let everybody say, oh, what a pretty little girl, right? With a cute little bow. Now, cradle cap just needs moisture. So what we do is you moisten it with mineral oil or lotion, olive oil, or whatever it is, and you put it on the head. And then a fine tooth comb, but gently. There's nothing aggressive here. Remember, you got a soft head there, so it's not going to come with the first time, but maybe after every night for a week or two, we can get all of that out and make that baby look nice with no cradle cap. Postoperative abdominal surgery child has an elevated heart and respiratory rate. What assessment might you make? What is that telling you about the child? Children don't tend to tell you things, and sometimes it's only by your assessment. And yes, classic heart rate, respiratory rate, blood pressure up. They might be crying, grimacing. They may not. They may just be laying there, not moving. So it for us to see that, then to get them medicated so that we can make them comfortable. What can cause rheumatic fever? M, that's strep throat, rheumatic fever, and acute glomerulonephritis. Strep throat, positive ASO titer, anti-streptolysin titer. That's what you would look for. The strep is in there. That's what you know what blood tests. An adolescent girl wants information regarding birth control. What does the nurse do? Do you give her information? Can you give her information? I mean, this is always a fine line, especially if you're a parent of adolescents. Yes, you can. You can speak to an adolescent without parental consent, but you need to give written and oral information and not your opinion. It'd be just like saying, well, where can I go? Well, Planned Parenthood, if there's a place, in your neighborhood with it, if there's still going to be Planned Parenthood, that's always up for grabs depending on who's in office, right? But written oral information is your answer here. A multi-select. How do you control GERD in an infant? Well, what is GERD? Gastroesophageal reflux disease. What is it caused from? So a lot of times GERD is the child doesn't burp well, or you lay them down immediately after feeding them, and sometimes or overfeed them. And this causes this little bit of reflux coming up. The problem with GERD is they're losing calories. And we know nutrition is the most important thing. So if you don't have calories, they're not going to grow. So add some rice cereal to the formula. It's not going to give nutritional benefit with the rice cereal because it's an infant, it's too young for food. The GI tract can't tolerate it, but the infant is not vomiting. So they're gaining calories by adding that rice cereal. So burp them, keep them elevated, and add rice cereal to the formula or breast milk. A multi. A 15-month-old brings a spoon upside down to their mouth, and the mother asks, is this normal? A 15-month-old, very young toddler, spoon's upside down. Is that a problem? And what this is, toddlers, you've got to let them experiment. Upside down, backwards, it doesn't matter. Let them just experiment and let them try. Absolutely normal. But there might be an underlying reason why the mother's concerned. Maybe she has another child who has an issue, or maybe knows her sister, her cousin, her aunt, whatever. There's a other child that this was an issue and then ended up that there was other things going on. So it could be the mother's concerned, but absolutely normal. Let them experiment. It's okay. Multi. How is juvenile idiopathic arthritis treated? JIA. So JIA is the body attacking joints. So as the initial treatment, you might give steroids. It's not a long-term treatment, but it's going to alleviate the pain at the moment. We call it a Band-Aid just for the moment. Long-term, methotrexate. We might even add on a biologic, Humira, infusion, something like that. And the drug of choice for pain is NSAIDs because they're anti-inflammatory and they do work. Okay. A toddler's vomited 2 times and he's listless and irritable. What do you tell the mother on the phone? Well, I guess the mother's called in to the doctor's office. or to the urgent care. Her toddler's vomited, but he's looking listless, irritable. What do they need to do with that child? And you think you have to vomit 100 times before you become dehydrated. I've actually seen young children vomit once huge and become dehydrated. You don't know what their hydration status was before they vomited, right? This is a child, listless, irritable. There's a problem. Get him to the ER. Tell her, don't give anything to eat or drink. Rest the stomach. Get them into the ER and then let them treat it. An absent status post amputation for an osteosarcoma is angry and blaming the parents. Is that normal? Why is he angry? Absolutely normal. You got to blame somebody. You did this to me. I didn't do it. Why did you look? Why do I have to have my leg taken off? Why? It's all that steps of grieving, and it's absolutely normal. Okay. Why should the nurse assess what should the nurse assess with children with hypo and hyperpituitarism? How do you assess these children? I believe they're talking about the anterior lobe of the pituitary gland. It has to do with growth, isn't it? So it's all about height and weight. Remember, I tell you, children every visit are getting a height and a weight, and adults never are. And the reason is because we're trying to make sure children get the nutrition they need and are growing the way that they should. Say, an infant with a TE fistula, what should the nurse have at the bedside? So we're not going to feed this child. PE fistula, there is a connection between the esophagus and the lungs, and risk for aspirations are so high, we will not feed this child, okay? We are going to have suction because they're going to be foaming a little bit with their own mucus and elevate the head of the bed. And that's about all we can do. NPO, IV, antibiotics on this one, suction equipment at bedside, and have the head of the bed elevated. A child's been having diarrhea for 3 days. What should the nurse check? Hmm. What do you think's most important out of all of those things down there? What's going to make the most difference in your care of that child? And it's the heart rate. Are they dehydrated? That is the answer, and that's what they're looking for. Elevated heart rate, decreased blood pressure, decreased urinary output, prolonged capillary refill, skin tenting. These are all things you see with children who are dehydrated. And of course, what's their mentation? Are they alert or not? A multi. What is a VP shunt used for? It's called a ventricular peritoneal shunt. So, a ventricular peritoneal shunt is inserted for those children who have hydrocephalus. They need to drain the fluid, cerebral spinal fluid, from the brain, which is building up through a tube behind the ear and into the peritoneal cavity so that we keep the pressure off the brain. Okay. So, to drain the fluid goes into the peritoneum and it relieves the pressure. What would you see in a child with autism? So children with autism, the one thing that's just so classic is those repetitive behaviors. Like I told you when I walked into doing clinicals and this little boy, actually was a Downs autistic of all things, but he would sit there after he got in, sit in the corner by himself, not listen to anybody, not caring, and he would take a something and put it on his stool and take something and put it on top of that and something on that. And then he would take it off and take it off. And then he would start again, putting it back on the stool, up and down and up and down. And he would repeat that over and over. And it gives them comfort. And that's why they do it. A multi. A mother of a child diagnosed with Duchenne muscular dystrophy wants to have more children. What are you going to tell her? What do you know about Duchenne's and mothers? That's how you look at that question. Then it makes sense. So, Duchenne muscular dystrophy. This is from mommy's X-linked recessive trait. And all males are going to have Duchenne muscular dystrophy. So, what would you do? Number one, you'll tell her. And the second thing is they're going to get genetic testing to see if there's something else there and look at the chances of her having another child if that's what she wants to do or take the chance of it and you ask her doctor, yeah, but it's more of we're going to recommend that genetic testing. Multi. An umbilical hernia has become hard and painful. What should you tell the parent to do when they call? Again, another call in to the clinic, another call in to the doctor. My child's belly button used to be soft and squishy, but now it's red, hard, and painful. What does it sound like to you? That's an incarcerated or strangulated hernia. And it's basically it turns and the blood supply stops. So you lose a piece of bowel if we don't get surgery and untwist that quick. So tell the child, the parent to make the child NPO and get them to an emergency room, where the doctor can be treated, where the doctor can treat them, a surgeon. What acid base imbalance is caused by hyperventilating? Talked about diarrhea. All the alkaline loses, you're left with metabolic acidosis. We've talked about vomiting, and you're getting rid of acid, so you're left with metabolic alkalosis. Well, hyperventilating, is it respiratory alkalosis or acidosis? And the answer is alkalosis. There was one HESI that had 4 different acid-based questions. So it's something I recommend you to look at. If you don't understand what I just said about acid and base and what it ends up as, please look at it and review it. A multi. A child's falling and a stick has scratched their eye. What should you tell the mom to do? Guess another mom's calling in. What do you do? So if that child, if they were in a doctor's office, we're going to take and we're going to put one of those hard eye shields, not one of those soft cotton things, but one that's hard so that if anything's there, it's not going to push it in. Right now, we need to get them to a pediatric ophthalmologist or into an ER. We never ever pull things out of the eye. If it's something we can see floating, we could take a piece of tissue and get it out. Okay, but if there's something stuck in there, box shield and get them to the doctor so they can take care of it, or they're going to lose an eye. An infant arriving at the ER is congested, febrile, capillary refill, lesson 2. What should you do? So we're febrile. Capillary refill's good, and we can see we have nasal congestion. The problem with an infant that's coming in that's febrile, have they had their immunizations, right? Is it RSV? And we can spread that to other children, especially immunosuppressed. So we're going to isolate that child, put them in an isolation room, or when they're admitted, we're going to put them in their own room so that we don't spread what they have to somebody else. A school-age child has reoccurring dermatitis eczema. What suggestion would a school nurse provide the parents? Sometimes dermatitis gets so bad, it's scabby, it's oozy, it's juicy, and it's open to the air, right? And these children are at risk for infection. And that's our biggest concern here. So what we tell them, I mean, hypoallergenic, what is that? It could be a food that's causing it. It could be latex. It could be other many things. No, it's not that. Homeschooling, no, you want the kid to be there. Keep them in cotton gloves. I think that would draw attention to them. What we need to say is when they are in these bad periods of flare where they're oozy and juicy and open, they need to stay home during those things until they're healed so that they don't get infected. A multi. Why do you give aspirin to a child with Kawasaki? Kawasaki disease, systemic vascularitis. Our concern is coronary artery aneurysms. This is red eyes and strawberry tongue and peeled palms of hands and soles of feet. So, aspirin, what is aspirin? It's an anti inflammatory, it thins the blood, and it prevents clots. Kawasaki doesn't have pain, it's just a virus and a fever, so it is not pain relief. How do you medically close a patent ductus arteriosus? Which one of them is to close the PDA? You see how I told you need to go look at those medicines again. You're going to see questions. Don't get them mixed up. Synergist, prostaglandins, indomethacin, which is what? To close it is indomethacin, okay? Indomethacin or indocin is an NSAID. And actually, before I knew it closed the PDA years ago, because it's an old drug, they used to have a pill. It used to be like a Motrin. It was for back pain and anti-inflammatory. It's an NSAID, but it's given IV and it closes PDA. Prostaglandin keeps it open, and Synagist is for RSV. A child post tonsillectomy is swallowing every 2 minutes. Why? We know if a kid is swallowing, there's something they're swallowing. And what they could be swallowing is blood. As I've said, I've seen a child literally just hemovolemic, just completely vomited clots and blood and blood. Heart rate went to almost 200, 7, 8 year old little girl. Blood pressure dropped. I had to take this girl, big liver sized clots in a basin in my triage room. I had to pick her up, run her into to the trauma room, had somebody help me get an IV and get a bolus of fluid in that child. A little 7-year-old took a whole liter of normal saline. And how do we treat it? Back to the OR, they had to cauterize the area. The big scab on the back of the throat came off and she bled a week after her tonsils done. A child is walking on their tippy toes all the time. Is that normal for kids to do that all the time? Walking on tippy toes. My daughter had a friend whose little girl walked on the tippy toes all the time. And I met her right at the beginning of COVID. And I knew this kid was autistic. She was just due. And because of COVID, it was hard to get her into treatment. But I spoke with her mother and father. And this girl today, sometimes she'll be on her toes. But boy, she's come such a long way in the last couple of years with me. But this could be that there are something's going on neurologically, or it could be something like, autism. Di. What treatment should a child in pain with JIA have? And if you've ever or known anybody with juvenile or just rheumatoid arthritis, it hurts. When those, muscles are swollen and stiff, it's very uncomfortable. Now, NSAIDs, absolute pain reliever for sure. Now, some children like hot baths. Don't ever put hot on me. I love ice baths, cold baths. So that's a choice. Either of them are a good choice. And then, of course, kids, give them an iPad, let them start playing whatever game, distract them, and their pain is not going to feel so bad. An infant sweet sweat tastes salty. What does that mean? I think you need to give the baby a bath if it tastes like salt, right? Honestly, we know that that is the test for cystic fibrosis. Now, are we going to check electrolytes because sodium's being lost? Yeah, we will. But what that is telling you, that salty sweat, that's telling you, oh, this is an infant. Maybe they're with cystic fibrosis. Let's test for it. And yes, we're going to test the electrolytes while we're at it. A multi. How do you diagnose dysplasia in an infant? So, hip dysplasia, the hip's not in the socket, it's up here. You have a shorter leg. The folds, one's going to be higher than the other. And we're going to hear clicking in it. Positive ortolani, asymmetric folds, and of course, a shorter leg than the other. You know whose legs the foot points inwards? That's usually adults with a fractured hip. Either inwards or outwards they can go, right? You didn't fall into it. Good. What causes acute glomerulonephritis? So again, rheumatic fever, acute glomerulonephritis, both caused by a strep infection. You get the history, excuse me, of a sore throat, and you're going to pull an ASO titer, an anti-streptolysin titer, and that's going to show you the strep is there. Say, what may be a problem seen after surgery for tetralogy of Fallot? Said something earlier. And again, tetralogy of Fallot, any cardiac surgery. Again, they're going to fatigue easy. They can have poor appetite because they have no strength. And of course, their lungs could be filling up. So, respiratory distress. I wouldn't say constipation. A multi. A child with pertussis is receiving erythromycin IV. Priority to include in this child's plan of care. So we're getting an antibiotic for pertussis. What do you need to be concerned about? Remember, antibiotics, and sometimes it's first dose, sometimes it's the last dose that children all of a sudden develop allergies to. And it could be anaphylactic, like facial swelling, urticaria, but it could be just what antibiotics do, that vomiting and abdominal pain and diarrhea that many children and adults get from antibiotics. Why do sickle cell patients have enuresis? Urinate the bed at night. Why? Well, how do you treat sickle cell? An ongoing, daily, how do we treat sickle cell patients? We keep them hydrated, don't we? Part about keeping the vessels open, the cells can get through. So we want them hydrated. So with all that hydration at night, they don't wake up, they're so tired, and they will wet the bed. And if it's scheduled for a cleft lip repair, which information is priority to convey to the surgeon before surgery? I would look at normal lab values. I would look at electrolytes, hemoglobins, um, and of course, red blood cells, CBCs. These are things that you're going to see little questions about. Now, the thing with this one is a red blood cell count of 2.3 million. Everything else is fine. It's all right. But we need to tell the doctor that before we go to surgery. Because remember, in surgery, you could always bleed, and that's our concern here. When administering indomethacin to an infant who has a patent ductus arteriosus, anticipate which outcome? What do you expect to happen as you're giving indomethacin to an infant who has a PDA open? What does indomethacin do to the PDA? Indomethacin closes the PDA. So all of a sudden, that washing machine murmur that you can hear is going to go away or be gone. In fact, I used to always listen to it as I gave indomethacin and try to figure out when did that PDA close. And again, I can also see it in the blood pressure if I have an arterial line in. And last question, when should solid foods be introduced to an infant? So solid foods are to be started at 6 months. You might see 5 or 6 months. We know one at a time, 4 to 7 days in between. All right. See how we did today. Savannah. Good job, Savannah. Number two, Jennifer. Good job. And number one, Dejaria. Good job. Number four, Lydia and Stacy. So this is one of your HESI review codes. As I said, you have two more. I would suggest you play with each other and, test yourselves on it. Those concepts you're going to see. And if you can, meet to me on Saturday for the HESI Q&A or listen to that review, and you guys will do great. Does anybody have any questions about anything? Grades will be out Saturday around noon as normal. That's when we're going to meet right before there. Don't worry, you're all
What
going to
was
be
the
fine.
medium for the test?
As I said, 82. It's not a bad before item analysis. That's actually excellent. Anybody
Bye
else?
bye.
Excuse me? Kirsten, I didn't hear you, honey. Oh, I guess you left. That's all I got for you today, guys. Have a good day.